Hi, friends. Rebecca Barnes, publisher of Prince William Living Magazine, and we are here today with Dr. Saumya Gill and Jennifer Handy D.O. They are both from Novant Health UVA Health System, and we are talking about strokes. So, doctors, I want to welcome you both. Dr. Gill, you are a board-certified neurologist, and Dr. Handy, you are a board-certified family medicine physician. So I want to welcome you both to Prince William Living. We feel that it's really important to talk about Stroke Awareness Month. And let's go ahead and get started. Dr. Gill, tell us a little bit about why you chose to pursue neurology and what types of cases do you normally see?
Hi, thanks for the welcome. My name is Dr. Saumya Gill. I'm one of the neurologists at Novant. And neurology is a fascinating field. It's been fascinating from day one for me. The human brain is complex, and there's so much that we have to know about and learn about. One of the reasons I picked neurology was mainly to get to basically help save critical brain tissue in the areas in which sometimes a stroke happens. When that happens, we have a code stroke process that's initiated in our hospital. For us, time is brain. So we really encourage everyone who's experiencing stroke symptoms, which I'll talk about later, to come into the hospital and get treated immediately. That can reverse potential outcomes.
Okay. Dr. Handy, tell us a little bit about why you chose family medicine and what in particular do you have a special interest in?
I chose family medicine because I love the focus on the whole person. I think that everything in a person's life, from their nutrition to their exercise, to their stress level, to their living situation, can affect their health. And I like to explore all that with my patients to tie it all together. My particular interest is in chronic disease management, diabetes management, high blood pressure, high cholesterol, to risk modify, to make the small changes that can make a big difference in long-term health and long-term outcomes in quality of life.
Excellent. Great. Dr. Gill, why don't you walk us through what happens when someone has a stroke and what are the different types of strokes that people can have?
Sure. So a stroke basically happens when there's a particular portion of the brain that does not receive the adequate blood supply. We call this an ischemic stroke if the blood vessel is actually blocked by a clot, and that's called an ischemic stroke. When there is a breakage or rupture of the blood vessel that leaks blood into the brain, we call that a hemorrhagic stroke. Both are very fatal, and the treatment for these are different depending on what type of stroke you have. Majority of strokes are ischemic. Regardless, I always tell patients, time is brain. So if you're experiencing any of these symptoms, which we remember as BFAST, which is brain, which is arm weakness, balance issues, facial weakness or facial droop, difficulty with slurred speech, and timing. If any of these things happen, come into the hospital right away where a stroke alert can be activated. And we will treat you from as soon as you get in through the door.
So tell us a little bit about that treatment. What do you do when you see a potential stroke patient?
So as soon as you come into the hospital, the stroke alert is activated overhead, and a critical care team, along with a neurologist, as well as physicians and nurses, meet you at the door and take you to the CAT scan. When you first get taken to the CAT scan, at that point, we determine within 3 minutes whether your stroke is caused by a ruptured blood vessel, which is known as a hemorrhagic stroke, or a ischemic stroke, which is a blockage in the blood vessel leading to oxygen deprivation in one portion of the brain. When we get this, we ask a series of questions in the next few minutes and perform a very thorough but quick neurologic exam to determine what part of the brain is affected and what type of stroke you may be having. Depending on that, we can administer a clot-busting drug called TPA, which is a short for tissue plasminogen activator. Basically, a fancy term for saying clot-busting drug. That can be administered for those who are experiencing an ischemic stroke, where the medicine will break up the clot forming the stroke inside the blood vessel. This can actually lead to complete resolution of stroke-like symptoms within 45 minutes to 2 hours. but we have a window to administer this drug. It should be within 3 to 4.5 hours of when you were last seen normal. The sooner you come in, the sooner you allow us to treat you with this clot busting drug, the better off your outcome may be and the less damage there can be from a potentially devastating stroke.
So time really is of the essence when you think that you might be having a stroke.
Correct. Regardless of the cause, again, we encourage that timing is critical. Time is brain. And we want to save the brain that's salvageable and not damaged yet, and reduce whatever brain tissue has already been damaged. And we have a method of doing that by determining what type of stroke you're having and what we can treat you with.
Okay. So we would encourage people to call 911 if they think that they're having stroke symptoms so that they can get treated as quickly as possible, get into
Yes.
your facility.
Yes,
Okay.
please do not have a loved one drive you in. That often wastes time. So yes, please call 911. They actually alert us of you coming in, which is called a pre-hospital code stroke alert. So we know even before you get in here, within that we're going to get a patient with XYZ symptoms within 10 minutes, and we're ready, waiting to treat you. So please don't call a friend, call 911 to come in.
Excellent. So for both the doctors, let's talk about how specifically women can manage their risk of stroke. What kinds of things, we'll start with Dr. Gill, but what kinds of things can they do to manage risks?
Sure. So one of the major risk factors for stroke is high blood pressure or hypertension. Hypertension, diabetes, high cholesterol are the major risk factors for stroke, along with obesity. And I'm going to hand off to Dr. Handy about what can be done to prevent these conditions. But that, along with increase in smoking risk and obesity, are the major risk factors for stroke. And I'm going to hand off to Dr. Handy now.
Yeah, another thing that is worth addressing is why it's so important for women in particular to address, to manage their risk of stroke. Strokes are more common in women than men. Women of all ages are more likely than men to die of stroke. And there are two particular risk factors that affect women and not men. And that is the fact that women can get pregnant and women use birth control pills. And both of those conditions can modify your risk of stroke because it changes the way your blood can clot.
Okay. So what kinds of things can we do in our daily lives to try to prevent stroke? Obviously, keeping our cholesterol lower and checking our blood pressure. What kinds of things do you recommend?
Mm-hmm. So the CDC considers about 80% of strokes to be preventable. You can't change things like genetics, but you can change some lifestyle choices that can increase or decrease your risk of stroke. My top 3 recommendations for the average person would be to quit smoking or don't smoke, moderate your alcohol intake, and optimize your diet. Those are things that any of us can do to, in general, decrease our stroke risk. But like Dr. Gill said, it is important to modify or manage your pre-existing conditions as well. So if you have high blood pressure, you are a cigarette smoker, if you have diabetes, heart disease, peripheral arterial disease, high cholesterol, obesity, those are all things that can be modified. And, a primary care physician is a great resource to assess your personal risk factors and minimize your risk of stroke, because many of these pre-existing conditions aren't symptomatic until they cause problems like a stroke. High blood pressure is considered the silent killer because it may not present with any symptoms, but it's something that your primary care provider could easily diagnose you with if appropriate and teach you how to manage in ways that decrease your risk of stroke and other sequelae.
So annual physicals to try to identify any problems, and then of course treatment of existing problems, and as always maintaining a healthy diet, exercise type of program, maintaining our weight, and making sure that we don't have any of those smoking or any of those other things that might add us to the risk of having a stroke. Are there any final thoughts or things that you can share with us in terms of things we should look for, things we should do, healthy lifestyle adjustments that we can make?
I think that it is so person dependent. I think that for that reason, it's important for each person, everybody watching this, to collaborate with their primary care physician to determine their personal stroke risk. Like I said, there are risk factors that you can't control, genetics, age, those things affect your risk level as well. But eating healthy, avoiding smoking, moderating your alcohol intake, and avoiding obesity and other risk factors can definitely decrease your risk level.
Excellent. Well, we appreciate both of you joining us today. We want to remind our readers that it is Stroke Awareness Month. If you or any of your loved ones are in a risk category, then be sure to encourage them to seek resources, talk with their physician, get their annual physicals, stop smoking, and really watch your behaviors that you might have control over. We're going to put some resources below in the comments so that our readers can follow links, do some research, and hopefully make the right choices to see a physician on a regular basis and make some of those adjustments as necessary. Doctors, we want to thank you both for joining us, and we want to thank Novant Health UVA Health System for sponsoring this interview. Thank you very much, doctors.
Thank you.
Thank you.